We're moving into the next session right now, which is the session on human development. As we indicated earlier, the Ibrahim Index of African Governance maps governments on their delivery of public goods and services in 4 categories: security and rule of law, participation, rights and inclusion, foundations for economic opportunity, and human development. Now we're moving into the discussion on human development, and it is significant, as I was pointing out earlier, that security and rule of law, participation, rights and inclusion, economic opportunity, all of that fundamentally is based on human reactions and human actions. And if the human resources are not properly developed or are not developed in a manner that can positively contribute to security and rule of law, facilitates participation, rights, and inclusion, you will not have the stability that enables economic opportunity for development. This panel session that will discuss human development is going to be moderated by Dr. Olivia Lwabukuna, who is a Tanzanian lawyer and a lecturer in African laws and development at SOAS University of London. She holds several degrees, culminating in the Doctor of Laws degree from the University of Pretoria in South Africa. She has worked for over a decade within professional and academic roles in South Africa, Tanzania, Swaziland, Kenya, Nigeria, and the United Kingdom. She's currently a lecturer in the Department of Law at SOAS University of London. She's also an associate editor of the Journal of African Law, Cambridge, and has been on a regular basis since the year 2017, convened the annual regional workshop on the rule of law and inclusive development in Africa. Her research interests lie in the area of law's interaction with development and migration. So I'm delighted that we have her to moderate this particular session. As we indicated earlier, for those of you who were participants in the earlier discussions, the Mo Ibrahim Foundation has, on a regular basis, every 2 years, taking over an analysis of periods of 10 years, looked at various indices pertaining to good governance. And I would like to invite Camila Roca, who is head of research at the Mo Ibrahim Foundation, where she leads on the foundation's analysis and publications on African governance, and also Inez Schultes, who's a senior researcher at the Mo Ibrahim Foundation, where she works on producing analyses and publications on African governance to give an introduction of how the indices were derived at and the particular areas with respect to Liberia. Camila?
Hello, everyone. Can you confirm that you can hear me? Apologies, but we had some slight connection issues here at the office. Thank you very much. As said before, we are now at our third panel. As said before, the Mo Ibrahim Foundation is grateful for this kind of invitation. We, myself and my colleague Inez, who are representing the foundation today here, are a part of the team who is building the Ibrahim Index of African Governance. So for us, this is a tremendous opportunity to sit with policymakers, civil society, and other stakeholders involved in the day-to-day governance work in Liberia and beyond. And we are extremely excited and happy to be part of the discussion and contribute with the data. I'm going to quickly share my screen and put up a presentation that we prepared to take you through not only the results, of the index for Liberia, but also a quick introduction into the methodology and the construction of the index to sort of provide you with a background. I'm going to put up my presentation in a second. Thank you. Fantastic, you should be able to see the presentation now. So as we discussed before, the IBRAIM Index of African Governance since 2017 provides a tool to measure governance progress on the continent and to highlight challenges. But first of all, I want to take you through what is our definition of governance, because I think this is key to understand a little bit what the index is all about and what the index can help us in this discussion. So for us, governance is really centered in the relationship between citizens and governments. Governance is the provision of political, social, and economic goods that citizens have the right to expect from their states, and states have the duty to deliver to their citizens. The foundation is committed to strengthening governance and leadership on the African continent since more than a decade. And how do we do it? One of the ways to do so is through the IBRAIM Index of African Governance. Here you can see at a glance the framework of the index. And this is a tool, a statistical data tool that helps us keeping track of governance development and progress on the continent. How is the index built? I will provide you here with a very brief introduction because this is a question that we are often asked. The index is built on external sources. It covers a period of 10 years of governance. And here illustrated, you can see the journey of a data point from selection of the data at source, apologies for the background noise, all the way until the finalization and calculation of the data. How do we select our sources? The index for the time being covers more than 40 sources. And besides being a suitable proxy for the governance dimensions in the index, each of the sources that we use has to follow and go through a very strict statistical selection criteria. First of all, we need each source to cover more than 33 African countries because we need to allow for cross-comparability across countries and across dimensions. But also, we put a lot of effort into making sure that our sources have data continuity across the 10-year time period, as well as data available within the last 3 years to ensure that we reduce as much as possible the amount of estimated data. Here it's a visual representation of how we collect the data from source and we normalize them. As you know, each source uses their own criteria to sort of classify the results, to put them all on scale. And once all the variables from source are normalized, so on the same scale, which for the index goes from 0, which is our lowest score, to 100, which is the best score, they are sort of aggregated according to the categories and subcategories of the index. One issue to note is that since our latest review of the index, more than 90% of our indicators are based on more than a source or a variable, meaning that they are stronger measures of governance, and also they contribute to mitigating the bias that would emerge by using one single source or one single variable for each of these measures. Before my colleague Ines takes you through the Liberia results, I just wanted to provide you with a very quick overview of where the continent stands in terms of governance progress within the last decade, to provide context, but also you will see that some of the elements highlighted here will also come back in the Liberia presentation. This is the continent in the last decade, and you can see that for more than 20 countries, basically 42%, about 42% of Africa's population, there has been an unbalanced progress towards governance. On the one hand, it is true that more than half of Africa's population is living in 2019 in a country where governance has improved since 2010. However, the way governance has improved and progressed has been really unbalanced. Governance progress has been driven by human development and foundation for economic opportunity on the one hand. However, at the same time, in these 20 countries, deterioration has happened concerningly in security and rule of law and participation rights and inclusion. So this is just to give you like an overview of the trends, and now Ines will take over and look at the Liberia results for the discussion. Thank you so much.
Thank you, Camilla. So first, what we're seeing here is like an overview of the overall governance score and the different category scores of Liberia over time. So we see Liberia scores 47.9 out of 100 possible. And that means Liberia more or less directly in the middle of the ranking table, so at 27th place out of 54. Over the last 10 years, Liberia has improved its overall governance score, which is very positive. However, we do see that between 2015 and 2019, the score has declined again. And this has happened at a pace 4 times faster than it has happened as the progress has happened over the decade. So, and also it's one of the largest declines, one of the 10 largest declines on the continent for that most recent 5-year period. When we're looking at what is driving these trends, we can see that, Camilla, could you go to the next slide, please? We can see that Liberia has improved in 3 of the 4 underlying categories. So it has improved in security of rule of law. It has the most improved in foundations for economic opportunity. And also the one we're discussing now, human development, Liberia has improved. The one category it has declined in, which was the theme of the panel before, is participation rights and inclusion. And we also see that security and rule of law and foundations for economic opportunity, they have started to decline as of 2015 as well. So that's why they're covered in kind of a pink shade to kind of indicate some warning signs here. If we go to human development, we see that the improvement that has been made over the decade has been sustained and it has even happened at a faster pace. So that's what we call increasing improvement. So between 2015 and 2019, so in the most recent 5 years, human development progress has really picked up. And the main kind of driver behind this is improvements in the health subcategory, which also, again, you see it's covered in dark green. So it means it has really increased the most or like quicker in the last 5 years. It is also the highest scoring category, subcategory within the human development category. But Liberia ranks slightly higher for education, which when we look at the bar chart, we see that education has declined over the last 10 years, although slightly slower pace. We have also seen social protection has very slightly declined, but we do see kind of a recent improvement in that one. And sustainable environment, which is a kind of new category we added in the 2020 IIAG. We see that sustainable environment really also has improved, which is very positive. However, Liberia still ranks among the bottom 10 countries when it comes to this. So if we look at a few of the drivers behind all the different trends, so what has been very positive is Liberia's improvement in compliance with international health regulations. So this is also very relevant in relation to the COVID-19 crisis, actually. Then we also see control of communicable diseases has been improved. Also more promotion of environmental sustainability, an increasement in social safety nets. So there's a lot of very positive areas here. On the other hand, if we look at the indicators that are driving more like the negative change, we do see absence of undernourishment as the most declined indicator in this category. Also, we talked about a decline in education. We see here education enrollment Also education quality have both declined. And then we also see kind of a contradictory thing here as well. We just talked about how environmental sustainability has actually improved and the promotion of it. But then we do see that environmental policies do not really seem to be enforced as rigorously anymore. Also, access to housing is getting more difficult and socioeconomic inequality is rising. So these are kind of the main drivers of the different trends in Liberia when it comes to human development. And it'd be very interesting to hear what the panelists will make of these results and will tell us about the situation in Liberia. Thank you very much.
Thank you. Thank you, Ines, and thank you, Kamala. Madam Moderator, the floor is yours.
Okay, thank you, Mr. Cooper, for the moderation, for the introduction of this particular session and for introducing me. And I also want to take this particular moment to thank the Ellen John Sirleaf Presidential Center for Women and Development and the whole team for organizing and coordinating this particular session. I'm going to go ahead and introduce our panelists. So we have a varied panel of people who are basically key experts in different contexts of human development. And I'm going to introduce them not specifically in the manner that they will present, but when we get to their presentations and discussions, their panels are going to be based specifically on their expertise. I want to take this opportunity to introduce our panelists. So the first one is Dr. Hena, who is a Liberian-born medical missionary and has spent decades implementing successful community-based healthcare programs in Russia, Armenia, Tajikistan, and Kazakhstan. And obviously she worked within this particular part of the world in Russia and became the first United Methodist missionary to serve there. And she's now working to reform Liberia's healthcare system through an initiative called Healthy Women, Healthy Liberia. She holds a medical degree from Cuban Medical College in Russia and a master's in public health from Emory University. She has moved to Liberia to lead our effort on that particular program on Healthy Women, Healthy Liberia. Dr. Chris developed the framework for the Liberian Health Education Initiative while still living and working in Kazakhstan over a 10-year period. And the program is now being implemented by organizing communities to identify and implement preventative care programs unique to each particular community, with specific focus on improving maternal and infant health care, improving the nutritional status of women and children, and restoring and maintaining community water sanitation, as well as reducing incidences of non-communicable diseases. So obviously, she's going to be one of our experts on the healthcare aspect. Dr. Mosoka Fallah has extensive experience working in humanitarian crisis situations. During the Civil War, Dr. Fallah worked with Doctors Without Borders in Liberia, and currently works on a consultancy with the USAID-funded project, developing program for recruitment, training, and deployment of community health officers. He has worked extensively with the Ministry of Health and Social Welfare in Liberia, medical centers, and other nonprofit organizations to jumpstart its flagship program in Liberia in 2009. He founded Refuge Place International, and it's a nonprofit that helps construct maternal, newborn, and children's clinics and develops health services in the slums of Monrovia in both the USA and Liberia. So his program obviously works in between the two countries. He has also helped to co-found Horizon International, a nonprofit that helps war-affected women and children in the Democratic Republic of Congo. As a public health expert, his expertise expands to maternal, newborn children, women, gender and health, public health, workforce development, as well as healthcare delivery and infectious disease epidemiology, specifically malaria, TB, and HIV/AIDS. He is a former Director General of the National Public Health Institute of Liberia. Dr. Romelle Horton is a native of Liberia and a strong advocate for educational, developmental, gender equality, service learning, and refugee issues. Dr. Horton is currently the interim president of Cuttington University in Liberia, where she provides leadership in developing, implementing, and continually updating strategies to support excellence in academics and development of the whole self. She graduated with a degree in Geographic Information Systems from Voorhees College and went on in Denmark, and also went on to in Denmark, South Carolina, and went on also to work as a solution delivery analyst with Accenture for several years before pursuing graduate studies. She has an MA in International Service and Development from the University of Surrey, which is now called Romelle in London. She also has a PhD in Educational Administration and Leadership, specifically in Education Management from the University of Botswana. She has served as a Deputy Minister for Instruction at the Ministry of Education in the Republic of Liberia, and also as a Chief Government nominee for the West African Examination Council. She has served as Vice Chairperson of the West African Examination Council as well in Liberia, as well as an African Women Academics in Research and Development Fellow. Professor Moses Zinnah is a Liberian agricultural and rural development expert. He has over 30 years of professional working experience with national and international organizations, the Ministry of Agriculture, research institutes, universities and colleges in Benin, Burkina Faso, Ethiopia, Ghana, Guinea, Liberia, Mali, Nigeria, Sierra Leone, Tanzania, Uganda, and the United States of America. Professor Zinnah currently serves as the Vice President for Academic Affairs at the University of Liberia. Before he was appointed Vice President in January 2020, he served as Dean of the William R. Tobit Junior College of Agriculture and Forestry at the University of Liberia. Previously, Professor Zinnah served as Minister of Agriculture, and as well as providing consultancy services for many organizations around the world. Our last panelist is Silas Ciaco. I'm avoiding to mention his mid-name, which I definitely sure I will butcher. He's a Liberian environmental and human rights activist who was awarded the Godman Environmental Prize in 2006 for his work gathering evidence that proved that Liberia's former president, Charles Taylor, was using profits from logging to fund the civil war. His work, carried out at great personal risk, led to the United Nations sanctions on the export of Liberian timber. Silas founded the Sustainable Development Institute and served as its first director from 2005 to 2009, working with communities to secure legal recognition and protection for their customary lands and to resist large-scale land grabs from monoculture plantation development. In 2008, he was among Time's Heroes of the Environment, and in 2012, he received the award for Outstanding Environmental and Human Rights Activism from the Alexander Soros Foundation. He continues to work for social justice, human rights, and environment. Ladies and gentlemen, as you can see, we have a very strong panel here before us of experts in the section of health, education, social protection, and sustainable environment, with varied expertise, but specifically within the context of Liberia. And these will be experts who will essentially engage with the Ibrahim Index on governance, the index and the report within the context of Liberia. I'm going to give the next 30 minutes to our panelists, who will each have at least 5 minutes to speak generally about human development, how they understand it and within the context that they come from and have worked within, but also specifically in relation to Liberia and specifically in relation to the findings of the index. I'm going to start by giving this opportunity to Dr. Chris Hena and Dr. Mosoka Fallah to engage with the first aspect, which is health, and then we'll get on to our other panelists. Dr. Hena,
Good afternoon to all. I want to say thanks to the Ellen Johnson Sirleaf Foundation for having me on. It is a delight to be able to participate in this. I've never done this. I'm a clinician and a public health officer, and I love to deal with my patient one-on-one, so this is pretty new and interesting. But I still am very grateful for the opportunity. I have been thinking seriously about the task when it came to human development. I read the IIAG index, the scores, the ranks, and the trends. And I must say, I was very fascinated to see how comprehensive that this work was done. When I look at the human development aspect of the opportunities and the access that our people have, it brought a lot of things to mind, a lot of things that I've been pondering on, given my background from the former Soviet Republic, and coming down to my own country and reading this index, especially as it relates to human development. So I'm left with a question that takes me back in the context of the Alma Ata Declaration of Health. Most of us on the panel will agree that we all have had experience with talking about this declaration. In that declaration, WHO correctly defined for us what health was. Also in that declaration, public health emerged with a primary milestone in the 20th century, how public health was going to be the attainment for us reaching health for all by the year 2000. So then my question, as I have looked at this data, which I said looked very impressive, when you look at the access that they have, you look at the communicable diseases, the non-communicable diseases, the control of children and maternal mortality, I am left with a question. 21 years later, after the 2000 goal for WHO, why are we still not providing coverage for all? That's the question that came to mind as I was looking at this human development, because we cannot speak of human development outside of the context of that definition. And so giving this very impressive work, I am impressed because I see it on the ground every day. But I'm still wondering if health for all is something that only the government will be able to provide. And then I can say truly that my answer was no. Even with the help of our international donors here in Liberia that made it possible, we still would need the private sector to come in for us to have the absolute conversation about human development as it relates to our poor little country, Liberia, with less than 5 million population. So with that, I was thinking about some of the advantages that our private sector brings into this, because I am in the private sector, a non-for-profit, low cost, where patients will have access to some of the services that we see here in this document. And as I was thinking about the advantages there, I thought about a couple of things. And one was how efficient the private sector is, how efficient that is. And the next thing that I thought about was the less waste, because when we look at our government resources and budget, they are limited. But then we see excessive bureaucratic regulations in how we go about. So when I think about the private sector, I think we have made a lot of inway in talking about this human development. And so I saw this very clearly when I looked at the model of health that was in the former Soviet Union, and then looking at the model that happened after the collapse of the Soviet Union, when people left the communist offer-service health and moved on to the private sector, and how much human development that I saw take place when they changed from that transition of the socialized government, excessive bureaucracy, regulation, corruption, less accountability, to the private sector, where there were more accountability, there were more empowerment, where people participated in their own health care. So today, I am very much open for us to dialogue this in the context of this beautiful document from the IIAG Scores, Ranks, and Trends. I will tell a little bit about our own clinic here that makes me to be a strong believer that the government and the private sector will have to work hand in hand if we are going to accomplish this human development that we all so anxiously await, when everyone can have health on the global scale. And at Waterfield, since I've been back here, I was born and raised in Kakata. I came with nothing but a heart to serve my people. And so I started at a little place in my yard. Sooner, I saw more patients coming, more people coming. And now today we have the Waterfield Primary Healthcare Center that addresses most of what I see in here that this document talk about: access to sanitation and water, communicable diseases, control of non-communicable diseases, which I can attest to because I was also a survivor of breast cancer. That brings me to this non-communicable aspect of our work here, where women are educated to take full responsibilities of their health. And to do that, we have seen the improvement over the X number of years. I've been back since 2012. We have seen the improvement in the vaccination schedule program, for example, in the nutritional status of them and their children. In fact, we are so proud when it comes to the maternal mortality department, where we're seeing women now give birth to twins, to triplets, and even quadruplets. On April 24th, we had our first quadruplets, 4. But then it's the private sector like us that have been able to not only include that group in our statistics, but to actually reach out to them and show them that health can be for all. we talk about the disabled. At our facilities, we have areas where disabled can comfortably come and also receive their care. So that also relates to the human development aspect, where mothers can come and feel comfortable with their delivery. That also develops that aspect of the human development we're talking about. So if we do not have health for all in the context of human development, how is that going to be for us here in Liberia that is still struggling to understand and overcome some of the things that we do? So I will leave it at this point and let us go from there.
Okay, Dr. Hena, thank you so much for that interesting and obviously very relevant contribution. And I think what we pick from you is the relevance and importance of the question of access to healthcare for all. And I would like to give this opportunity to Dr. Fallah to just build into what Dr. Hena just finished on specifically. And I also just want to remind our panelists that you each have at least 5 minutes, and then we'll come back to the issues that you feel are outstanding when we give you an opportunity to wind up. Dr. Fallah, please.
Thank you very much. Thanks to Dr. Hena for this brilliant presentation. I have decided to take the discussion to a slightly different angle in the context of human development. That is the interaction, the intersection between health and education. We clearly have seen that they are very linked. You need both of them to have human development. When I was a young student at Harvard, we had an expression on the board. Your current status was not determined by your mother's pregnancy. It was determined by the pregnancy of your grandmother. That tells us how much, and some of those impacts included your IQ. We clearly have done some studies to clearly show that the future IQ of an individual is determined by the environment of the mother's pregnancy, is determined by nutrition and water and breeding. These determine future IQ and future income. That's what clearly has been established. In the case of Liberia, if we start from health and have the health influence education and the reverse, we do know that we have increasing low birth weight. There is increased nutrition. I know despite the fact that we are making progress with health, but there is yet more to be desired. We do know that 30% of the population stay out of the 5-kilometer distance. They lack access to healthcare. We do know that in terms of absolute number of physicians and nurses to patients, that the number is disproportionate. Those in rural areas have limited access, while those in the urban center have large area. And so that affects us in our malaria control program. Malaria in pregnancy affects low birth rate, and that in turn affects the future of growth and educational development of the children. When we come to look at issues like communicable diseases, we still face a challenge of a major default when it comes to tuberculosis. One of the countries, we have one of the lowest notification rate. We haven't achieved the 70% required, and we have an extremely high defaulter rate. All of these factors tell us that we have a challenge. The health sector is making gains, but we still have to look at the issue of the human resources for health. The issue of stockouts is still a perennial problem with our country. Stockouts, the last Global Fund report I reviewed clearly stated that HIV and TB patients could not receive their tests for over 6 months because of the lack of stockouts. And so a disease in a sick population cannot be a vibrant population, cannot be developed. We've made some progress. We've reduced maternal mortality in our last demographic health survey. We're clearly seeing improvement, but there is still much more to be desired. Our overall infant mortality rates are getting up, but neonatal mortality is an issue. So as a nation, as we approach the issue of health, there are much more challenges to be solved. But one thing we have learned is that the education arena of our country helped to improve the health. Just 3 days ago, Pfizer vaccine got approved by the FDA as a testament to the power of education to improve healthcare. The critical issues that we face today in healthcare can be resolved by building viable, sustainable educational system. It's going to be very difficult for us to improve on our health indicators if we don't have indigenous local scientists that will try to solve them. So that is one area we need to really, really improve so that local instructors, the university become the center of solution for healthcare. That is a major weakness we need to improve. That means to say we need to be able to attract educated, highly successful scientists, either those in the diaspora or those that have completed school, and bring them back home so they can answer questions, scientific-related questions that are contextual in nature. Why is it that we still have increasing neonatal mortality? Why are we not succeeding? Why is it that we have the issue of supply chain that can never be solved? Why do we see this increasing maternal mortality rate? We conducted a research on the number of maternal deaths over 5 years. What we saw, the issue was not the issue of access. The women were going to have deliveries. What we also noticed was it was the quality of care that was an issue that was causing higher maternal death. We did that because we were to conduct a research. We conducted a second research to understand the prevalence of diabetes type 2 in Liberia compared to the rest of Africa. Based on the research we conducted, we saw that almost 2.7% of the population in Mosoka County are pre-diabetic, which means they could become diabetic to increase the number to 3.8. And we calculate the cost of having 3.8% of the 1.3 million people of Mosoka having complex diseases like diabetic and hypertension, the cost it will give us. So basically, we have a health issue. We made some progress, but until the educational system gets better and vibrant, we can never be able to develop a health, because whether it's in the US that have been able to develop vaccine in Europe, we have issues that only African Liberian scientists must be able to address. And so how do we build that intersection between healthcare and education? That has to happen at the tertiary level. How do we attract the brightest and the smartest to come to the university is a critical issue. So in closing, I will speak about my experience with the Popular Health Institute of Liberia. Many of us have completed studies in the US and we came back home to help serve our country when Ebola struck. We play a very cardinal role because of the level of education we got. I was trained in infectious disease epidemiology. We were able to help the response and bring our country outbreak to an end quicker than the other country. But education was the key. And so after that, Her Excellency President Joseph decided to form the Popular Health Institute. We went to Norway, and the cardinal thing we got was to infectious diseases. They must attract the most brilliant. They must be paid very well. Once we started the Popular Health Institute, we realized that we needed brilliant people to run the institute. How could we do that? We're not an educational institute. So we worked with the university to build a Master of Public Health program. The first Master of Public Health program at the university was developed by us. We saw that there has to be an intersection between health and the academics. And so what we did, we said we need trained manpower, we need epidemiologists, we need infectious disease experts, but we can train them, but we provide our expertise to the university for the university to be able to train these people that will come back to us to help the country. And you can see for some of the output on the healthcare that the major driver of our improved health in Liberia is because of our ability to respond to epidemics. Because we invested in highly qualified people, the system is there to respond to epidemics as early warning. And so the human index, as much as we are doing well in Liberia with the health, some part of the health, but there has to be a way that health and education must move in tandem. And to do that will require a lot of investment in attracting the brightest, the most brilliant, that can develop research questions to feedback on the health sector, to give policy implications.
Okay, thank you very much, Dr. Fallah. With that particular contribution specifically related to the relationship between healthcare and other socioeconomic aspects, I'm taking this opportunity to bring in our educational experts because your discussion links very well into that second aspect on education. So Dr. Romelle, Horton, and Professor Zinnah, we'll start with Dr. Horton and then get to Professor Zinnah. You might come in as well and just bring in your contributions there.
Good afternoon, everyone. Thank you, Dr. Fallah, for that great plug in for education. There was a huge thanks to the EJS for organizing and including only to rate our government, but also to put us under the microscope. It is my hope that we move beyond discourse and form a plan of action on how to talk IIAG report. The Human Development Agenda does not have a fast forward option. System reform between 2010 and 2019.
Dr. Horton, perhaps if you could take off your video.
Follow me down this timeline.
Dr. Horton,
we'll take it off.
Yeah, we are struggling here. If you can just take off your video, perhaps that would help with hearing.
Is this better? The Human Development Agenda does not have a fast forward option. People at the center of the human development paradigm and exception. Education in Liberia began substantial systemic reforms between 2010 and 2019, following down the context of a timeline. Of the 5 subcategories under education in the report, I'm going to focus on the 2 lowest, enrollment and quality. The Education Reform Act of 2011 calls for a free and compulsory 9-year basic education, comprising 6 years of primary and 3 years of junior secondary education. We move on to the Agenda for Transformation Pillar 3. This also focused on expanding access and improving the quality of education in Liberia. The Getting to Agenda of 2015 of the Getting to Best Education Sector Plan 2017 to 2021. Now we have the Pro Agenda for Prosperity and Development that posits expanding equitable access to education and achieving more inclusive and higher quality education. All of these reforms or plans that we have focused on ensuring equal access to education, which has a direct impact in correlation to education enrollment, and an increased number of teachers with certified training, which also has a direct impact on the quality of education. In 2006, Liberia had a 37% for access to education. Fast forward to 2017, we were at 87%. When it came to the issue of schools, in 2006, 70% of our schools were destroyed due to the civil crisis. In 2017, we had constructed 506 new schools, renovated 303, had equipped 1,785 schools with wise facilities. In 2006 again, we had scarce to none textbooks in our classroom with a 27:1 per pupil ratio. In 2017, we had 3.9 million readers and learning materials procured for public schools with a 1:1 per pupil ratio. Why this timeline? Because it is disconcerting that Liberia most decline indicators in education under the Human Development Plan are these 2, enrollment and access, which most of our reforms targeted. The questions now become, if free education is enshrined in the Education Act, why is there a dip in enrollment from 51.1% to 39.8%? On the side of this same coin, the government embarked on an unprecedented teacher vetting and qualification scheme, testing our teachers at the foundational level to ensure they were skilled for the classroom. More than 6,000 teachers were certified at that time, and the B certificate program, which had been lost for a long time, was reinstituted for our teachers to be qualified to be there. So once again, I ask, why did these reforms not transcend us to a better place on IIAG report, or more importantly, also like to plug in equality in education here. The education data in 2018 show we had a 51% of female enrollment. So it's really great to see that we are still holding our own when it comes to equity in education for gender. Parameter needs to keep going higher and higher and higher for female enrollment, recognizing that we need to innovate to address the challenges in our education system. Strategic, evidence-based learning in this country. We need to build on what we have learned, our achievements and our shortcomings from the last decade and beyond. And we, our teachers, principals, education officers, our education sector partners, to ensure that we are providing the Liberian children with the access and high quality education that they deserve. Dr. Fallah spoke about bringing in higher education. We are bringing up great teachers. We have done so much for access. Where are we with the
Dr. Horton, I'm going to take this opportunity to recap what you've been saying and then let Professor Zinnah come in and hopefully finish up the discussion on the areas where you were touching on because you seem to be struggling with your internet. Is that okay? Professor Zinnah, can you please come in? And Dr. Horton, we thank you very much for your contribution. I will circle back to all of you with questions, and hopefully at that particular point in time, you'll have a chance to pick up and finish the points you didn't get to. Yeah, can we move on to Professor Zinnah? And then when I come back with the question, you get an opportunity to pick up on the points that you didn't complete. Hopefully then the internet would have settled, if that's okay.
Thank you, Madam Moderator.
Yeah.
I think my colleague, Dr. Horton, touched on a couple of things. I will just go through what she may not have touched because of the challenge with the internet. Let me thank President Sirleaf and my former boss herself, the President, and Dr. Weeks. I work with both of them. Thanks for inviting me to be part of this panel. Dr. Fallah, I'm happy that you started this very well. You can see that all these issues are actually related. When you look at the UN Sustainable Development Goals, there's no surprise that they lay these 7 goals side by side because no one goal can work without the other. And of course, I see education as the least common denominator for everything. Without education, it's difficult to plow through the challenges that human beings face. Dr. Horton has already spoken on some two or three points. I will just focus on maybe 2 things that she may have not touched on because she agreed to discuss the other ones. Human resource in education. I was really surprised that the indicators give us a huge pass, positive 11.2%. For me, in fact, this is the most challenging aspect of our education system. The data may have spoken, they have been collected, and the interpretation, I leave that to the scientists, the statistician to decide. But when you look at the education system here in the country, human resource is one of the most critical components. In fact, for me, it's one of the weakest links. If you don't have good tutors, if you don't have trained professors, instructors with the environment to work with the students, it becomes a challenge. Our teacher training institutions are weak. And the incentives for teachers, even the trained ones, are not going to teaching because it's not exciting to be a teacher. So to have a pass in this area, we need to explain this data with some carefulness and put it within the context. because I know teachers are not happy here, and the environment for teachers to work is really, really challenging. The rural areas are hard to reach. So it's an area, even though we have a pass, we need to interpret this data with some care. But it's good that at least we are making some progress there. Then of course, the quality of the education. We score opposite in terms of the scores that in terms of quality, our quality has gone down minus 10.9, almost 11 percentage points. This is very, very important for us to take a look at it, because over the last 10 years, and Dr. Horton has just spoken to this because she was at the Ministry of Education, she provided leadership there with my colleagues in the ministry. We don't have a problem with policies. When I was reviewing the data, I saw more than 4 good policies already done. And she was part of the authorship for crafting this policy. They're well crafted. Our challenge is we don't implement policies, and we tend to reinvent the wheel. You don't need to change things when you have a challenge. You look for where you need to fix. I was in Nigeria, my colleagues always say, we'll face the bus as it's running. You don't have to stop the bus completely and fix it. If it's running, keep fixing it as you're moving, because time is of the essence. We are slightly behind in terms of education compared to our other colleagues in Africa. So I think in terms of the quality, of course, she mentioned some things that we can do is to strengthen the capacity of our teacher training institutes, to ensure that we have trained teachers that are licensed to teach, and they should be paid properly. Again, that is relative, because the challenge of our economy can also determine the pay scale. But you cannot have good citizens if you don't have good teachers. And I'm happy Dr. Fallah mentioned this very well as a medical practitioner. If you didn't have good environment to go to school and learn, it would have been difficult for you to be a good scientist. So those are things we need to improve. And of course, he mentioned something that I'm going to also mention, but putting emphasis in terms of at a lower level. I know the Ministry of Education with partners are trying to create the STEM courses beginning with the primary schools. You need to create vocational technical education with science, technology, engineering, and mathematics. You can't jump over this. To compete, you will need people who are strong in the STEM areas so that they can be employers of themselves and they can be employable when they finish instead of waiting for a job when they graduate. So these are some of the reflections. I know that Dr. Horton has already mentioned some of those issues. I will stop here, and then we will have some questions from our colleagues who are also connected and logged into the webinar, so that we can have a more open discussion and we can respond to some of the issues in the index report.
Thank you very much. Thank you very much, Professor Zinnah, and thank you for that contribution. And obviously, as you pointed out, there is a strong connection between all the aspects of human development that we are discussing. They are all related to enhancing capabilities. So whether it's education, whether it's healthcare, whether it's social protection or the environment that we are going into, they are all aspects that become important for human beings, not to better themselves, but to better also those around them and their community. From that particular point, I want to welcome Mr. Siakor. I hope I'm pronouncing his name well. He's going to come in last to discuss the aspect of social protection as well as the environment, which I'm very certain will in one way or the other link up to the other discussions we are having within this particular context of human development. And then we'll move on to the question session. While I'm also having this discussion, I'd like to encourage our attendees to please put in questions in the discussion section, so that we'll pick up on those questions and then we'll discuss them. We'll channel them to the panelists, and then we can engage. Mr. Ciaco.
Thank you. And I just want to quickly also thank the foundation, the center, for inviting me to participate in this panel. It's indeed an honor. Especially the opportunity to speak to some, I think, very important questions that many Liberians will have on their mind. How do we get beyond where we are? How do we improve? How do we influence an upward trend in governance overall, but also in development, the human development aspect as well. To do that, I just want to kind of take a quick step back and try to take stock of a few things. I think it goes without saying, and Dr. Zinnah alluded to that just around his closing point, that Liberia has some of the most progressive policies, laws, and regulations related to the natural resource sector, related to environment, related to social inclusion. And there's so much of it on the books that one wonders why is it that we are still struggling in terms of saying overall improvements in the sector. So just as a quick example, the rights of citizens to participate, for example, in forest governance, and the right to benefit from the revenue that's generated are very clearly laid down in the laws and in the policies. The rights of the citizens to participate in forest governance processes, the right of the population to access information, the right of the local populations to a share of the revenue that's generated from logging, for example, are all very clearly laid down in our laws. And that goes on, it applies to the land sector as well. So a whole range of very positive legislations, policies are all on the papers. But I'm not going to dwell on that because I just want to pick up on where I think the index really hit the nail on the head in terms of really identifying where Liberia needs to step up and make some improvements in order to improve overall human development. So just as the report shows, we are saying increasing deterioration in terms of our failure to implement the policies that are there on the books. And I would kind of expand that to include the whole legal framework. The evidence is there, it's very clear. For example, when you see villagers traveling from rural parts of the country to come and visit the authorities, the state agencies in charge of managing these resources, and say to them, we are being negatively affected by your failure to implement the law. You don't need a rocket scientist to tell you that that failure is having a very dire consequences on the people in those areas. When villagers show up in Monrovia, set up shop at the Ministry of Finance and demand to see the minister because they haven't remitted their fair share of the revenue that's being generated that could be invested in health and education in those rural areas, then you realize that something is not right. Something needs to be corrected. So there's a lot of sufficient blame to go around, and I'm not going to get bogged with that. I just want to mention three quick things that I think we need to tackle as a country, as a people, in order to really make some progress. First, and this ties into all the other comments that have been made about education, the quality of education, access to education. Technical capacity is extremely low at all levels. In the rural areas, within government, I should say, but also within civil society, at all levels of society. Technical capacity to implement these progressive legislations are extremely low. The second point I think factor that's responsible is that the population is not taking full advantage of the policies and laws that are in place, that are designed to really stimulate sustainable human development at all levels. And I think unless the citizens can start to take their role, their responsibility seriously, we will continue to see weakened law enforcement or failure to implement these laws. The third, but I think perhaps the most important factor is the lack of political will from those in position of power and authority to implement the policies, the laws we have on the books that are designed to really stimulate development at all levels of our society. And this could be manifested by putting, for example, the right people in the right places, looking for the best talents that are available and deploying those talents for the greater good. It could be manifested by investing in capacity development, because there is no way you transfer responsibilities to different state agencies or the population, and you do not provide the means in order for them to develop their capacity to respond to those challenges. And finally, I think at the very top, we need a very clear, very strong, very progressive leadership in order to bring all the different actors together. I think these factors together pose very significant challenges, not only to environmental sustainability, they also have very negative impact on social protection. Because if we are putting in place policies that are designed to help people lift themselves out of poverty, and we do not implement those policies, and we allow for the laws to be flouted by different actors, then of course we are not providing the leadership that we need to provide in order for that to happen. So in closing, I would like to say that looking back over the last 20 years that I have actively been engaged in the natural resource sector, we have seen some really good improvements in terms of the legal framework, and that can touch on many different aspects of the index. The problem we have, we are not implementing those laws. The institutions that are in place to implement those policies and laws are not doing what they are required to do. There's a lot of improvement we could make in those areas if we are going to succeed, so that maybe in the next decade, when we are talking about the index, we will be saying very clear improvements in those areas where we are not performing very well. And I think for this year's report, the performance or the poor performance on the failure to implement environmental policies and laws is very clear, and that's where we need to channel a lot of energy. Thank you.
Thank you very much. Thank you very much, Mr. Ciaco. I'm going to take this opportunity, first of all, to tie the discussion together and then quickly bring in one question that allows us to move past this panel discussion session into the question and answer session, so that we bring in our attendees as well, and so that they can participate through asking questions. So the key things that come out, and starting with the first discussion that was presented by the first presenter, the things that for me stand out from the discussion of Dr. Hena all the way to Mr. Ciaco's discussion. Dr. Hena talks about the private sector and healthcare and how she feels that the private sector would be important for the question of healthcare. And I think that goes for all African countries. But at the back of my mind, I'm always wondering, what sort of private sector do we have? How developed is it? What kind of support does it have? Wouldn't the possibility of the private sector stepping up negate the role of the state? And that's what comes to the back of my mind. And I think we would have those discussions as we move forward. But when we come into education, and the same thing goes to aspects of healthcare, the question of technical skills, which are related both to education, but also technical implementation of certain policies, comes out once again. And so for me, within the context of education and the development of capabilities, I think about what type of education are we talking about as Africans and as Liberians? Are we emphasizing maybe one form of education as opposed to an education that is relevant for the Liberian context? And I think one of the presenters talks about training, vocational training, and that sort of education in combination with the formal education that we know or are used to. But also when we talk about formal education, I also want us to talk about the quality of that education and what we are measuring that quality against when we are talking about the quality of that education. And that naturally comes into the question of teacher training. It comes into the question of resources for those teachers. It comes into the questions of salaries for those particular teachers. And obviously the last presenter talks about the discussion of policies, which goes back to, I think, what we left hanging with Dr. Horton on why reforms are not happening. And she's at the forefront of that particular session. So I would like to also hear her talk about why she thinks the reforms aren't really reaching the ground. What happens between the ministry and the people on the ground? What happens in between? Where do things go wrong? Is it lack of will? Is it lack of technical capacity, as we are talking about? Is it the failure of people to demand from their leaders, as the last presenter, Mr. Ciaco, talked about, that lacking capabilities to push for what is important for them, for their rights. And so from that point, I would like to go back to every presenter and have them tie down their discussion before we pick up questions from the panelists. So just 2 minutes for every presenter, for every panelist, and then we get into the questions from our attendees. I'll start with Dr. Hena. Dr. Hena, are you there?
Yeah, you talked about the private sector. When I think about private sector, I think about the different categories that could be developed. For example, you may have a high-end facility and hospitals that will gear towards the wealthy. Mm-hmm. Because in your society and in every society, you will always have the wealthy who will have money to spend there. But then also you will have low cost, for which many will be able to pay and also access, but not diminish the quality of the care. You may also want to have free facilities. For example, in places that I have lived, we have vast resources amongst the doctors, the nurses, and other trained professionals who are willing to volunteer their time and have this free clinic for people who absolutely will not have the means to access. We can do that. So for the 3 different modalities still needs to be worked on, I think that's what will be. The faith base, for example, here, I said I started off in a very, 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 very primitive setting. There was absolutely free care for 5 years. There was not a dime that was spent by any client on health. But then we were able, because the way the people around us saw how effective, how efficient we were, how we had less waste. We had a lot of people coming in to help us. There were little or no corruption in there because we were accountable to those people who were funding and bringing in the resources. So that's what I think when it comes to the private sector, so that it would not negate what the government or what the private sector would do, but they will work hand in hand to lift the burden of the government that has limited budget for health, if we want health to be for all. That's what I'm thinking.
Okay, thank you. Thank you very much for that response, Dr. Hena. I want to bring in Dr. Horton and Professor Zinnah. What do you think has been limiting the reforms that you probably instituted and were part of setting up, Dr. Hena, when you are part of the ministry, but also Professor Zinnah can pick up on that and let us know as an educationalist what he thinks limits the reforms trickling down to the bottom on quality education, on proper education and payment for teachers, on equal education, on human resources aspects. Dr. Horton. Dr. Fallah, and then we'll get to Professor Zinnah. I think Dr. Horton is struggling.
Yeah, what's the question for me? I saw you asking Dr. Horton.
Yes, I was asking about, I think you talked about healthcare and you also went into education. What do you think limits the reforms, specific policy reforms that are targeted towards reforming the healthcare or education sector from trickling down to the ground?
I'll give you statistics. The WHO require that the physician to patient ratio should be 1 to 1,000. Currently, we have 298 doctors, so our ratio is 1 physician to 15,000 patients. So how do we produce such fewer number of physicians? It goes back to the educational system that's supposed to serve as a feeder system to feed into the doctors that will be produced to serve our people. That's one. So it then comes to how do we translate the policy? The question we have to ask, who are writing the policy for us in Africa? Most often, almost most of our policy is that we bring these Western consultants who write the policy for us. Sometimes, why is it that we try to rely heavily on consultants to write our policy? How strong is our educational system? How strong is our own orientation to get to the university? Why can't we try for all of our problem to be solved by the universities, by the higher learning? Why is stopping us to say every one of our policy will go back to the university? I was in Thailand to study their model to bring to Liberia, and they had a university as a key component to write the policy that are context-based. But the key it comes back because we don't have a better reform education to attract the most brilliant scientists that are writing and publishing. To be called to consult, you must be able to write well and publish papers, be an expert in your field. But we lack that because there are no resources. And so it's how good is a policy that is reflective of our context? That's one. And if it's not good because we don't have a good educational system to pull them up, then the problem becomes we don't have this policy that we can implement. That's a key to note. 99% of all vaccines for the 1.3 billion people of Africa are imported. Why can't we develop industry to do vaccine? It comes back. How much are we investing into education? In summary, our issue on policy translation to implementation, we realize over and again is leadership. Highly competent male-level leadership. It's not male-level leadership that head this institution. How invested are they in the policy? Is it a foreign policy or is homegrown policy? These are going to be where we got to bring the university in the development and evolution of policy. In the writing of the policy, they do consult the local people. They do consult, or we just flew in an expert for 1 week who read 1 or 2 documents and then read for us. So how context specific is the policy? B, is it driven by major stakeholders? Do they have an input in that policy? So then when they see the policy having their input, they will have the honors to implement the policy that then benefit education and produce the brightest that then help the health sector. Thank you.
Thank you very much, Dr. Fallah. You probably referred to one of those things that are usually important to me, context-specific reform that essentially takes into account local needs. And I think I do agree with you. That's one of those very main specific challenges that we have where we have helicopter experts, as I call them. Professor Zinnah.
Thank you, Madam Moderator. I think Prof. Mosoka Fallah has answered that question, except that sometimes some of the policies are hard decision policies, and they are difficult to take because they have a lot of political implications. Take, for example, I was in Ghana in the middle 90s when Professor Atta Mills, at the time he was the head of the revenue, they imposed a 2% tax, but directly for education. And it was accounted for, the account is known by everybody. Go to Ghana today, you will see laboratories, you will see science-based education, and they target their training based on what they need. when they were exploring oil in Ghana, they quickly had a university or a college for mineral exploration. So you are planning ahead. But some of these decisions are not easy decisions because they have a difficult. I know if he had run that time as a president, he may not have won, because for 2 years they debated that. We have to find resources for education. It is not cheap. But if you fail to invest in education, you are planning to have a difficult way to run a nation, because no nation is run by people that haven't had basic education, because you have to compete. And another thing that we did not mention, which is not in the report before I leave and give my chance to other people, is as we look beyond COVID, the education system is going to change slightly. We need to begin to think through that beyond the IIAG data, because we have already started. It is not by choice. Education is going to be partially virtual. How do you plan for that, so that you start at the elementary level all the way to college level? That is another challenge that is going to impose another headache for us to consider, but we cannot run away from that possibility. It's a fact. I'll give it to
okay, thank you. Thank you very much, Professor Zinnah. I think the COVID discussion becomes key and important, and it's probably an underlying discussion for everything we put forward right now. And I also think the discussions we've been having on a weak or struggling healthcare system, an education system that has issues, social protection issues, get more pronounced as we come out of COVID. I want to take this opportunity to allow my panel to think about the idea of policies that are badly made. So not looking beyond the other discussions we've been having. Are policies set up in a manner that allows them to be implementable? Or are they set up just for purposes as well of just ticking that box, because then it makes it very impossible to go forward with them? I want to bring in questions from our attendees. The first question is for Ms. Rocker and Ms. Schultz. A major factor, in addition to access to water sanitation, air quality, healthcare, etc., is light or power. As our youth need lighting to study and our citizenry needs this for development, how is access to lighting or power incorporated into the larger human development scoring? This is for the IIAG team.
Yeah, thank you so much for the question. I think we can answer it. Okay, perfect. So just to take a step back, the inclusion of what we call energy and electricity, it is indeed there, but it's at a different level within a different thematic area than human development. The choice of what dimensions belong to which thematic area is not an easy one, because certainly we do acknowledge that, for instance, access to energy, electricity, light, and all that, it's a key issue for functioning health education systems, for instance, as much as it is sanitation, which is under human development. But we thought that for the purpose of the index, it would fit better under infrastructure, because it is also a key infrastructural element as much as, for instance, transport, communication, and digital networks are. So it is here, and you can see from the screen that I am sharing that Liberia, it's indeed on a path of improvement. So there has been actually a very remarkable improvement in the past decade when it comes to access to energy. However, the country still ranks relatively low, so there is still some challenges that remain, but we do have to consider that this dimension is on a path of increasing improvement. So this means that if the effort is sustained, there is potential for positive change. I hope this answers your question. And if you allow me, I also saw that there was a question about gender, which is actually related to what we were discussing right now. Again, gender, it's indeed a key element of access to health, access to education, and all that. And for the reasons that I've just explained, gender is, however, placed under our category, which is called participation, rights, and inclusion. So the reason why you haven't heard us talking about this is that the gender experts and the gender results were discussed under this particular thematic panel that happened just before this one. And here you can have a look at all the relevant results for gender. And after the end, at the end of the event, we will share also a Liberia country profile that provides additional analysis as well as the presentation. So you can have a look at the findings for gender in those documents as well. Thank you.
Thank you. Thank you very much. And this is a question that I think is also related to the Mo Ibrahim team, so I might as well bring it up before I move to the other panelists. The question is asking whether someone could please speak on the issue of student performance as an additional indicator to enrollment and access.
Yes, I read the question. I think it's a very interesting one because obviously the students are the beneficiary of the educational system. However, without their primary engagement, there is no outcome, right? However, for the sake of the index, we do limit our measures to anything that is strictly related to governance as we defined it. So we look at policy input, we look at policy outcomes. However, to what extent, you know, like for instance, youth is performing or is engaged in the learning process, that it's a little bit outside the scope. But it's certainly an area worth exploring, I guess, because it's really interesting and it's a key enabler for good outcomes as well.
Maybe if I can add on that as well. I think we've discussed including some measures related to that actually. Something like, for example, learning adjusted years, you know, like how well do kids perform according to how good they are expected to based on the levels of education they've received already. However, this is an area, for example, where we do like quite a lot of data. So something like that unfortunately limits us as well to just looking at enrollment rates and things like that, just because there is not much data out there, or not in the comparable way that we would need it for the index to allow more of an assessment of these kind of things as well. And we do have some indicators on education quality, but ideally we would also have kind of something like learning outcomes. But unfortunately, the data landscape does not really allow that yet.
Okay, thank you. I'm going to ask one more question to the panelists, and this is targeted towards Dr. Horton or Dr. Zinnah or both. The question is on access to nourishment. The question says that access to nourishment is a major contributor to human development, and nourishment there is almost around health. But they say especially in the area of education levels and enrollment, and obviously that is a consequence of nourishment. What government measures can be improved to reverse the drastic rate of change seen in absence of undernourishment, which has dropped by 13.5%?
Okay, I thought, is that there? But I know the government has had the policy of school feeding.
Mm-hmm.
So that is one area, and I know that they had that policy working closely with WFP and others. So that's one area. Even when we were in school, I remember in the late 60s, to keep us in school, they fed us in the rural areas, and that is a bigger factor for retention, for keeping kids at school, because some of them don't eat at all when they get to school. They come, they won't pay attention. So, but Dr. Romelle Horton can speak to this.
Dr. Horton, if you may. Okay, Dr. Horton.
You're muted.
Yeah. I think she's still struggling with her internet. So I would like to take this opportunity to ask each one of the panelists. Dr. Horton, are you there? No. Okay. I'd like to take this opportunity to ask each panelist in 1 minute to give us their closing remarks, and then we can end this particular session on a strong note. I'll start with Dr. Hena.
I'm sorry. Can anyone hear me?
Yes, now we can hear you, Dr. Horton.
I sincerely apologize. It's Tommy. We were talking about, I started talking about nourishment. Can you guys still hear me? Mm-hmm.
Yes,
nourishment. Yes, we have had, school feeding has played a huge part in enrollment, because as Dr. Zinnah tried to say, students come to school knowing that they're going to be fed. Will indeed have more students in the classroom. We have people that have come in to getting students in school, as Dr. Zinnah also alluded to. Most students come to school because that's the only meal they're going to have a day. So we need to put efforts in place to ensure that we are continuously feeding students to ensure the enrollment stays what it should be.
Thank you very much, Dr. Horton. Now, can each one of you, at least our panelists, give us one closing remark, specifically within the context of where you see human development moving towards in Liberia post-COVID, and how Liberia should deal with it within your specific sections, starting with you, Dr. Horton.
Thank you, because I'm so afraid my internet is going to come out.
Yes.
So I'm just gonna go. And what we would like to see a robust system underpinned by qualified, professionally trained, motivated, supported, and well-paid staff, especially in the areas of health and education. These are the cornerstone of every effort.
Professor Zinnah?
That we are trying to do. So to our students.
No, finish, please.
Because as I was saying, we need bold and progressive reforms are needed if things are to change, so that every child can have access to high quality education that allows them to fulfill their potential and contribute to the development of not only this nation, but the region and the continent.
Okay, thank you much, Professor Horton. We thank the internet for being really supportive there. Professor Zinnah?
I don't know if you got that.
Yeah, I did. We did.
I think that this is a good exercise, that we are looking at data that is trying to tell us what to do. I think what we need to do is to have a balanced education system, that you can balance technical, vocational, and science-based education, so that young people they can graduate and be employable or to create their own jobs.
Okay, thank you very much, Professor Zinnah. Mr. Ciaco?
Yes, I think I will have to go back to the point I tried to make earlier. I do believe that there are extremely progressive policies and legislations on the books, at least in the sector that are working in the natural resource sector related to environment. We really had a situation in which Liberians were the drivers behind the progressive legislations and policies that I talk about. I think we go easy a little bit on those that are in positions to implement those policies. When we say, well, sometimes the policies are parachuted in from elsewhere. That may be true for some sector, but I do believe for the natural resource sector, I am a living testament to that fact. we have worked very, very hard, and we do believe if those policies and laws are implemented properly, we will indeed reap real benefits in terms of human development.
Okay, thank you very much, Mr. Ciaco. Dr. Hena?
Yeah, for me, I would say that both the private sector and the government should have one goal, and that would be a healthy delivery services to its citizens that will lead to a healthy population, which in turn will lead to human development.
Okay, thank you very much, Dr. Hena. And our last panelist, Dr. Fallah, I think, if you're there somewhere.
Yeah, I'm here. So wherever there have been problems, in all parts of the world, they have looked to higher education to solve the problem. It's about time we invest in our higher education. You want better teachers, you want to develop the university and put the brightest, attract the brightest. You want people to evaluate policy, look to the university. Healthcare and education must work hand in hand. It's about time that by investing in better, higher quality, higher education, that then drive the teachers down to the primary school, and then they want to do research and collect data to evaluate policy. I wish for the day when the university begin to publish very scientific papers, policy brief for government, and saying to government, you made this policy on education that Dr. Horton was presenting, but 10% have not been achieved. The university must be the center for change. We must invest in the university so we then become the watchdog for the society to evaluate this policy. When many countries in the world face problems, they tend to look to the university. Moderna vaccine was developed by Harvard. When we reach that point that we have a university that will evaluate this policy, we're right. It's a two-way street. Good education, quality education will produce the manpower to run better health system. And with education and health, you're bound to succeed as a nation. Thank you very much.
Thank you very much, Dr. Fallah. I want to take this opportunity to, first of all, thank the organizers of this event, the Ellen Johnson Left Presidential Center for Women and Development, the Executive Director, and all your team. Thank you so much for having us here on this particular day. I also want to thank the Mo Ibrahim team and the Ibrahim Index on African Governance, and for the work that they've been doing. They've given us fodder to discuss and things to think about. I also do not want to forget our attendees who have spent this afternoon with us. Thank you very much for the questions, for the engaging discussions, for your comments. We couldn't engage with all of them, but we thank you that you were there and we noticed all your comments. And so as I close, I thank everybody who attended, and I hope you have a lovely evening there in Liberia. Thank you very much. Oh, I also want to thank Councillor Cooper, who is essentially running this whole particular amazing session. Thank you very much, everybody, and bye-bye.
Thank you. Thank you very much. Thank you very much, Dr. Lwabukuna. It's much appreciated. We appreciate the effective way that you all have been able, this panel has been able to address critical issues, tie the links between education, health, as well as sustainability relating to environmental sustainability. I think there's been much thought that has been put in the deliberations that have been done by this particular panel, as has been throughout the day. And we want to join our voices to thank you, particularly for the way in which things have been handled. May I ask, as an administrative matter, the communications team would like the panelists to please stay on for a moment, just as we recess, so they can make some technical adjustments to the name tags, etc. And we'll recess at this particular time and reconvene at 5 o'clock to deal now, having dealt with the security and law reform and rule of law issues, as well as participation and representation and human development. Now, how can we put in the proper economic framework to help to support all of this? That will be our next discussion beginning at 5 o'clock. So we'll recess until then. Panelists, please stay on for a moment. Thank you.
Thank you.